Welcome to The Culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are The Culture.
Miami-Dade, we are strong, we are resilient, and we will get through this together. There are everyday actions that we can take to help prevent the spread of COVID-19, including wear a mask, wash your hands, practice social distancing, stay home when you're sick, and get tested. Get tested whether or not you have symptoms. Even if you think you're healthy, you can still infect others. Free tests are available at Miami-Dade County testing sites. Private test sites may bill your insurance or charge a fee. To find a testing site and make an appointment online, visit miamidade.gov/COVID-testing. Good morning, and thank you so much for joining us for another edition of The Culture. I'm your host, Jessica Garrett Modkins, and joining me today is Dr. Yvonne Johnson, Chief Medical Officer at South Miami Hospital, practicing in the emergency department. Welcome to the show, Dr. Johnson.
Thank you, Jessica. I'm pleased to be on with you today.
Yes, we started this journey back in March, and we were thankful that you were able to come on and provide some insight into COVID, especially as it relates to African Americans and how that is adversely affecting our community. But I wanted to back up a little bit. We've never got into this aspect of it. The medical field is not a traditional field that people aspire to go into, yet it was something that you have found yourself in and have been thriving. Can you give us a little background as to what made you want to even get into this field?
Well, it's interesting because I think if you asked most doctors about their journey into medicine, they would say, "Oh, I wanted to be a doctor my whole life," and it became a fulfilled dream. For me, in fact, I graduated from college thinking I was going to go to law school.
Oh, wow.
And in fact, studied for the LSAT, the test to get into law school. And then I had a family member who was hospitalized at Howard University Hospital. And I saw these teams of Black physicians and residents that were rounding on all of the patients, including my family member. And I thought that that hospital was the most exciting place I'd ever been. And I think I was also excited by the fact that the majority of the caregivers, the nurses, the doctors, the residents, the technicians were all African Americans. And so it not only inspired me because they seemed to know everything and knew all about all of those patients as I watched them round, but because they also look like me.
Correct.
And so I think there is absolutely something to that that notion that when you see something that is achievable, when you see yourself reflected in that, then it is achievable. So I was really blessed to have that experience at Howard, and then ended up applying to Howard University College of Medicine, and that's where I became a doctor.
Wow. Nice journey. Nice journey. And now, as I said before, we are here months into COVID-19, and I wanted you to come back on to provide insight into where we are, what has happened since the last time we spoke, and where we're going. There's also talk about a vaccine that's supposed to be available next month. But let's just start with where we are right now, Dr. Johnson.
Well, right now, unfortunately, we're in the midst of another surge. If we're going to talk about the national picture, then I think that is really very concerning. That there are so many places across the country where they're facing shortages of beds, shortages of caregivers, where they're being overwhelmed. And the one thing that we have learned in this pandemic is that one of the biggest variables in terms of patient survival is the hospitals not becoming overwhelmed. if you remember back in March, what it looked like in New York and some of the places in the Northeast, their their death rates, their mortality rates were much higher than most places experience because they were just so overwhelmed with the number of patients. So we really don't have that much more in therapeutics for COVID. There are a couple of treatments that are available that we do utilize, remdesivir, intravenous steroids. So there are things that we have learned over the course of time. We've also learned a lot in terms of how we utilize our oxygenation for patients. So how we treat them when they're hypoxic, when they don't have enough oxygen. We try not to intubate people too early, those kinds of things. But for the most part, we don't have a whole lot more now than we had back at the beginning. But what we do know is that when we have the time and the resources and we're not overwhelmed, that we definitely are able to give better patient care. So I think that is the thing that is concerning across much of the country, is that we hear in places like Texas and in the Midwest, in some of those Rocky Mountain states, that they just don't have their medical infrastructure is just being overwhelmed by the number of patients. And that's actually what we saw here in July. So that was our situation in July and August, following Memorial Day and 4th of July and all of the, kind of gatherings like that. And I think also the fact that after we came out of March and April, we kind of did that collective sigh of relief and said, okay, so things weren't so bad. And I think we had a lot of poor messaging from our state leadership about what we had just been through. And, we had a situation where, rather than saying, okay, we did all of the right things, we stayed home, we social distanced, we, put our masks on when we were outside, and all of those things were effective in bending the curve and us not having a surge in March and April like we were expecting. I think the message went out that, okay, so this is over, we made it through, we're done. And, we didn't get what you said we were going to get. And that was just not the right message. So I think we kind of let our guard down. And like I said, we socialized a little bit too much in May and June and July. And then, we saw that really tremendous surge, and it put a huge pressure on the medical resources here in Miami-Dade County. So, we don't want to see that happen again.
I've been doing some reading, and I see that there are other cities that are on lockdown again with curfews, and they're taking it very, very seriously. But I do believe I read something about the fact that Florida would not go under any new sanctions and any type of curfews or anything like that. I believe some mayors gathered and really wanted to address it with the governor. But in light of that, there is some self-responsibility that we can govern for ourselves without having to be instructed by a higher law enforcement or any other type of rules to be in place. What's some advice that you can just give us, especially as we're in the holiday season? We would like to frequent and gather. What are some things that we need to be mindful of so that we can help ourselves?
Yeah, I think that we really do have to understand that when we gather, when we get together, we give the virus the opportunity to pass from one person to the other. And that's all that the virus cares about. It is seeking opportunity, and it's going to exploit opportunity. So we want to limit the opportunity that we give it to go from one person to another. So, certainly when we're out and about, we've always, we've had that mantra over and over again that we need to wear our masks, we need to stay, 6 feet away from other people when we're out. But one of the biggest risks right now are when we allow people to come into our bubble at home, because most of us at home, we take our masks off. When we're by ourselves, we're not wearing our masks. So when we're in our homes with the family that we live with and we eat with, we're not masked. And so now we have these holidays that are traditionally we're bringing, friends and family in, and that's where I think we're very vulnerable, because we use this word trust so much that, oh, I trust this person, I trust that person, I know that they're clean, they're good, they do. The problem is that this virus passes from one person to the other when we breathe near each other. And so if your family members or your friends breathe, they can transmit the virus. And I don't know any of us who have friends or family that don't breathe. That's all that you have to do. You don't have to be, wild or, out partying all the time. It's not a moral failing to get this virus. It's ubiquitous. It's out there. And so I think we have to be really very careful. That's what I'm seeing over and over and over in our situation. People are not getting sick here at the hospital. When I think of like our employees and others, it's outside, and it's typically in those gatherings. They can usually find that they, had a friend that they then call them and say, oh, we were together last week. Well, I just found out I tested positive. And then they find out that they start having symptoms. So, that's what we're at risk for during this holiday time, is we're used to bringing people in. And, one of the other things that I think we need to consider is, a lot of the talk is that, well, this is something that we're just going to have to start living with, and we're going to have to live our lives, and we can't put our whole life on pause while we deal with this virus. Well, I think we got some really good news that I know you mentioned, that we do have several vaccine candidates on the horizon. And so those are game changers for the end of this pandemic. So I think there is the prospect for this pandemic, for the end to be in sight, but we've got to get there. And so if we can avoid getting sick by just, kind of changing how we do this holiday season, this Thanksgiving, this Christmas time, if we can just modify that to accommodate the idea that we cannot, get together without masks outside of our tight family bubble that we've controlled for all these months. If we can do that, I think there is hope for, next year to be completely different, for 6 months from now to be completely different, and this pandemic to be over. But we want to, get to the other side well and healthy and alive.
Yes, we do. And you mentioned the vaccines, and I understand there are, I believe, two that has been reported that are looking to be, uh, for lack of a better way, launched or made available. They did say that they were effective with 2 doses, but they were not talking a lot about the side effects. Do you know or have you read anything about what the side effects are as it relates to those vaccines?
So right now, there's actually 3 vaccines that have been
Okay.
reported on. 2 of them that were tested here in the United States. The third one, I believe, was tested primarily in Great Britain.
Mm.
So the 2 vaccines that are here in the United States are in a platform called an mRNA vaccine. And so the at least preliminary data, and as it's reported, I have not read the data myself. I have spoken to two of the investigators who are right here in Miami-Dade County. They are people that are on my medical staff that I know and actually trust. And I've spoken to them about their involvement in the trials. And so what has been reported is that those two vaccines have a greater than 90% efficacy, meaning that they have prevented the transmission, or the people who've taken them, they have prevented them from getting sick 90% of the time. And what's really exciting is that among those people who took the vaccine and did get sick, it prevented any of them from having severe illness. So even those that did get the virus and tested positive for the virus did not get sick enough to have to come into the hospital and have any significant type of care. So I think that's really exciting in terms of the efficacy. But your question is, what about the safety? So, what are the side effects? And from what I have, what has been reported is that it's been very minimal, that it's really more kind of injection site soreness. Sometimes people felt a little bit of that, viral kind of feeling that you get where you're a little fatigued and tired in the few days after getting the vaccine, but there were no major illnesses reported from the vaccine. And this is with a pretty significant number of people tested. I know the Pfizer and the Moderna vaccine was tested on somewhere in the range of 30,000 people each. So, I think that is a significant number of people. The other thing that I think is that I can at least speak for the Moderna vaccine. I'm not sure about the Pfizer. I believe it applies to Pfizer as well. But they really did get a good cross-section of people so that, we can say that there were people of color, it was a diverse population that was tested. Because a lot of the time in medical testing, we're not included.
Right.
Historically, except when they were testing, things on us and, under the table and not really letting us know that we were the guinea pigs. But in those well-run studies, we were not always included. And so you could draw conclusions about how well the drug worked on, white men, but women were not always included. Minorities were not always included. And so, you may not really be able to draw those same conclusions. But in this, we did have some diversity, a significant amount of diversity in the testing. So, I think that from what I have heard, from what I've read about it, and again, the FDA has not cleared them yet, but from what I have heard about the data, what I have spoken to the investigators who were actually involved in the studies, there really is reason to have a great deal of hope that these will be significant game changers, that it can, if we get enough people vaccinated, once we get enough people vaccinated, that it'll change the dynamics of this pandemic, and we should be able to see an end in sight.
Nice. And so would this be similar to the flu vaccine where you would need to have it once a year?
I'm not sure about that. So I don't think that they know yet how long does this immunity last. The level of immunity seems to be in line with something like a measles vaccine. And most of us have only had to get a measles vaccine once, sometimes twice. There have been those of us who got vaccinated long enough ago that, and with a different vaccine than what they're using now, that, we've had to get revaccinated. But, if that's the case, and if it gives us the kind of immunity that is as long lasting as that would be really amazing. So we're not certain yet. The two that I spoke about that were tested here, the Moderna and the Pfizer vaccine, are both, you have to get 2 injections. 21 days apart. The other interesting thing about the Pfizer vaccine is it has to be stored at sub-zero temperatures. And so they have provided those storage containers to allow us to keep the vaccine, in those very, very, very cold temperatures.
Mm.
So that, creates some degree of challenge. But, you can imagine it's going to be a big job to get this whole population vaccinated, and also, I think to overcome some of the challenge that has been created unnecessarily by the politicization of the vaccine.
Yeah.
The idea that we were on a political time schedule rather than a scientific time schedule.
Mhm.
And I'm at least pleased to see that there was a lot of resistance in the scientific community, in the pharmaceutical community, to providing that vaccine on a political time schedule, because that is just not how it works.
Right.
The data comes in when the data comes in.
Mm-hmm.
And you should not be able to manipulate it in that way. And I think when there were calls to provide a time schedule for the data, it undermined even those of us who really believe in the science of vaccines. It undermined our confidence in it. But my confidence was restored when those calls were not answered, when the timetable of how this vaccine and the data was produced happened on the scientific basis and not on the political time schedule.
Okay, that's good to know. That's good to know. And then we have seen some evolution in testing, I would say. When we started, there was the long tooled cotton swab that would go to the rear of your, I guess, nasal passage. But now there's saliva that they are collecting. I know here at the South Dade Government Center testing site, that seems different to me than where we started.
Yeah, there's definitely been a lot of movement and a lot of progress in testing. I think still we struggle with having all of the components of the test available. So, while we may have testing machines here at the hospital, sometimes we don't have the reagents, the chemicals that we need to test, and the amount of numbers that we need to test, particularly in some of the rapid testing strategies. I think we have some testing that is just testing for the antigen, that is widely available in a lot of outpatient centers like urgent care centers and facilities like that, where you can get results back within 15 or 20 minutes. And I think that has been a big, big game changer. They're not quite as accurate
Mm-hmm.
as the testing where, they're testing the PCR testing where they're putting the swab down your nose. But I think, especially if you're getting tested on a routine basis, even those tests that are not quite as accurate as a one-off kind of thing where you just do it once, when you're getting repeated tests, it will accommodate for the fact that they're not quite as accurate. But they're certainly, most of them are very accurate. They're over 90%. So when we're talking about, tests that are not, where there's some false negatives,
Mm.
it's still talking about a small number. But because of that, again, you cannot rely strictly on testing. And I think we saw that play out for us, perfectly at the White House.
Mm-hmm.
We saw where they were relying solely on testing. They were not putting that testing together with social distancing and mask wearing. And they had, several outbreaks as a result. So it's all, you don't get to just pick and choose from science, one from column A, two from column B. It really is a package deal.
Mm-hmm.
So, how we accept the science behind avoiding COVID-19 is a yes and strategy. It's not an either or. It's a yes, we're going to do this, we're going to test, and yes, we're going to wear masks. And yes, we're going to social distance. And yes, we're going to limit the size of our gatherings. And, so it's all of those things that help to reduce the risk of passing it on. So, I don't want people to think that, okay, well, we just tested everybody who's coming over for Thanksgiving dinner and nobody had it. Yeah, nobody had it when you tested them in a amount that could be detectable by the test. That doesn't mean that by the time you sit down for dinner that the virus has not reproduced enough in one of those guests to then allow them to pass it on to several of the other guests.
Wow.
So, you cannot rely on just one strategy. It's all of it together.
Well, Dr. Johnson, thank you so much for your time. Before you leave, I would like to see, is there anything else that you can provide for our African American viewers that they just need to make sure that they are aware of?
Yeah, I think that we have been a community that has been more impacted by this virus than most other communities. And I think there is some recognition of that by the at least the new administration that is coming in. And so there is going to be some consideration given to our community as the vaccine is distributed. At least that's my understanding. Mm-hmm. And, I think everybody should certainly talk to their doctors, read, investigate, but I don't want us to have such skepticism that we don't take advantage of getting vaccinated when we have that opportunity. Mm-hmm. We certainly know how devastating getting COVID-19 is for many of us. And so particularly those of us who are at high risk of having a poor outcome from this. So those of us who are, over 55, 60, 65, and I've kind of lowered that number. If you look at the data, they would probably say 60. But, there are very few people who are, even 55 who are African Americans who don't also have high blood pressure, sure, or who don't also have diabetes, or who are not obese. And, I'm talking about the medical definition of obesity, not the fashion definition, because, for many of us, we like how we look with a few extra pounds. We would not necessarily describe ourselves as being obese. But if you measure your BMI, right, you might fall into that category. And it's that measurement that makes you at risk for a poor outcome with COVID-19. Mm-hmm. So it's not a value judgment. I'm really looking at the actual number. So when you measure your BMI, if you fall into that category where your BMI is over 30, then you're at risk. Mm-hmm. So there's very few of us who have made it to a young age of 55, but who don't have some of those other issues, asthma or COPD, kidney problems. So any of those things make you at really high risk of having a poor outcome if you get this disease. And, most of us don't want to have to continue to live our life in isolation. And so, you have to weigh the risks and benefits of everything. Mm-hmm. We get in cars every day knowing that some people have a car accident. Right. Most get to their destination safely. I believe that most people who take this vaccine, from what we've seen so far, at least of the two in the United States that have been released, the Pfizer and the Moderna, the data looks good that most of us who get that vaccine would do well. Nice. And would not get the disease. Mm. So, I think that we should have those conversations with our doctors, have those conversations with people we trust, look up at the data as it comes out. And as we get those approvals and, weigh our risks for getting a vaccine or not. The other thing that I would say on the topic of vaccines is please get your flu shot.
Mm-hmm.
The influenza has very similar symptom profile as COVID, and it also can strike in together with COVID. We did have people last flu season when COVID first came out in March that had both COVID and influenza, and you don't want both together, and you also would like to be able to at least take one of the considerations off of the table if you were to get sick. So go out and get your flu vaccines. They're free in a lot of places. The Walgreens, CVS's, all of the Baptist urgent cares. I know they are. So definitely get your flu vaccine. That would be my word to the wise. And just try to remember that there will be more holidays. If we play this one safely, then there will likely be more holiday seasons for most of us. And that doesn't mean we have to sacrifice this one completely. It just means that we need to do it as safely as possible. And that might mean doing it a little bit differently than we have done it traditionally. So
right.
Those would be
right.
my words of wisdom.
Well, thank you. You always bring insight, and it's so appreciated. And we thank you for taking time out this holiday season to provide this insight to help our viewers to not only make it through, but go through thriving with knowledge that can allow them to be able to be safe. Thank you again, Dr. Johnson, for joining us, and thank you all for joining us for another edition of The Culture. We'll see you tonight at 6 p.m. for another edition of My 2 Cents. Thank you for joining.
Thank you for the opportunity.
The Culture is produced and owned by Hip Rock Star Media and cannot be reproduced or broadcast without written consent by Jessica Garrett Modkins. All rights reserved 2020.